approached him, and that was the first course we did on WhatsApp on diabetic awareness. I was very hesitant and I kind of volunteered that ना आप कागज में लिख के दे दीजिएगा, मैं कोई पंच ऑपरेटर से करा दूंगा, ये कर दूंगा, because doctors are not known for writing by hand, right? And at the most they write prescriptions. To write the way he wrote is amazing,
remarkable.
And he created his own audio welcome. Yeah. He wrote all those posts, and writing those 25 posts is an enormous kind of a thing. So, and then this is a surprise for him. He didn't come, he came here with a normal session expecting 25, 30 people to do that. And it just occurred to me that let's try this new format. And I'm sure that when we put this up on YouTube, we'll see this as a very interesting thing. And more so because the conversation steered towards a whole lot of things, which is, see, if you look at a standard diabetic awareness program, it will give you risk factors, this, that, measure your waist, measure your weight, this. But this has really been something which is, I think, telling people about the nuances of diabetes. And that diabetes is not management of one number, but management of a whole lot of things, and especially the time variations that you talked about, because when Ashok started talking about insulin, then you realize that it's not a question of one number or even an average number. See, everybody knows that HbA1c is great, but it's not at all great, because what do you do with a 3-month average? You average my income with Bill Gates' income, what do you get? It's a meaningless number. Correct. So HbA1c, which was very much hyped some time back, is now actually proved to be irrelevant. Because if it varies with the day, time, etc., then what is 3 months thing? And whether you take a treatment based on tablets or insulin, etc., you have to look at the time variation. So I would want you to elaborate on a few things. One is that this is the new kid on the block. See, I also come from a diabetic family. I say, garv se ko hum khandani diabetic hai. And when I was young, I used to do these things for my father, that the Benedict solution or failing solutions आता था. Benedict solution से ऐसे urine test करते थे, color देखते थे, burner के ऊपर करते थे, वो सब. And that was good because school में भी chemistry lab में काम करते थे. It was quite interesting. I heard this KW syndrome when I was a very young kid, because several of my uncles had died out of it, जो आजकल nephropathy वगैरह कहते हैं. But I think the new insight which I have got during my interactions with him and this thing is that the biggest mistake people can do is to wait for the threshold to arrive before going for treatment. Actually, as an entrepreneur, Shashidhar, when you want to say, I say if you take a typical person who's in a high income bracket and doing knowledge work, the financial loss that is being caused to him because of not managing his diabetes is a very interesting number, and it will shock them out of their wits. Because it is not just the threshold and retinopathy or this thing, etc. Your productivity as a knowledge worker drastically reduces if your sugar levels are high. So there was a lot of discussion. I saw, well, it was 120, now they have said 100 as this is scale. No, they're telling you to monitor earlier. And the lower or the appropriate sugar level is a very important thing. And I therefore want you to elaborate on one, the continuous monitoring system, because I want to actually put a chip here which was given by him. So today you have continuous monitoring system. So, and this is not, as he was asking, available in India or not, available in his office. I used it for 3 months. It gives you, for 3 weeks, it gives you a whole idea of the pattern that is happening. And as Ashok said, that your fasting may be higher than your postprandial. So you have to interpret that. And if you just take HbA1c, to me it is a meaningless result now, if you are anywhere this thing. It may be useful for a pre-diabetic, but once you are a player in the diabetic domain, so I would want you to elaborate on basically the time variation story of managing the sugar. The other thing that I would like you to elaborate on is that if you detect diabetes early and you manage it well, you have another problem, you live long. And therefore geriatric issues start coming. See, my uncles were fortunate, they died at 53, 55, etc. They didn't see what a long life is. But I'm seeing people around 80, 85. I have friends now who are my seniors who have taken pension for more years than the number of years they taught in IIT. I have a living example of that. Yeah. So these issues about geriatrics almost start following, because if your life is saved, it's a long life. And the long life is well into 80s and 85. today people of 70 are considered like, I think, what, 25 or 30 of yesterday, maybe that kind of thing. So some issues on that. And another one, of course, I can go on and on, but another one is that you had mentioned in one of your earlier things that the elderly should also take certain vaccinations. And it's not just diabetes related, but related to old age. So just like at the pediatric stage, there is a whole protocol and schedule that you must take this at this month, this at this month, and you take some 12 vaccinations to protect you for the rest of your life. I think for the elderly also, there is a schedule which is not very well known. Nobody kind of publicizes it and so on. But obviously, if you want to live a long life and a healthy life, you must do that also. So a number of that is available, and I think we need to educate people on the importance of that. I first heard of it from Dr. Malviya. He was something, and everybody considers him like an outlier, that he says something which is way away. I think so. Maybe
I'm hearing for the first time.
Yeah, exactly.
It will be there in my presentation.
Okay. Yeah. So maybe if you can address this, and then you can have the general presentation.
I think Professor Pant has always been a difficult patient. First time when he came to my clinic, he knew more diabetes than me. He said, I know what KW syndrome, I know what to eat, what not to eat, how much exercise to do. But tell me, doctor, how to do that? Behavioral change. I said, that's very difficult to tell. I can tell you what not to eat, but how not to eat that? How to prevent yourself from eating is always a difficult question. And now he put up 3-4 very important issues. One is the sugar variability. Sugar variability is very important to the extent that he said HbA1c is useless. It's not useless. It has its own limitations. HbA1c is the average of your all-time sugars for last 3 months. The day you did it, before that 3 months, what your sugar has been. So that's only useful when you're assessing the control of your patient when you've been using certain drug regime, how well it has been controlled, or a patient who's already under good control just want to monitor that he's under good control, but does not reflect the variability which he very clearly said. Maybe morning time is going very high, but evening time is going very low, average comes normal. So again, the whole purpose gets defeated. So the gold standard of test still remains is getting your fasting and post-parental sugar down. So gold standard still that. HbA1c, just to monitor the efficacy of the treatment schedules.
So this one, like to interrupt. When Dr. Amrish Mittal was monitoring me, for the first time he started, you tell me what is your blood sugar levels before your evening dinner.
Yes, very true. I tell you, I'll come to that. A person, when we are trying to diagnose him whether he is diabetic or not diabetic, it is fasting and post-parental. But when we are monitoring the effect of the medication, normally we see what is pre-lunch and pre-dinner, because he is already on medication. So obviously when you give him a medication at the time of dinner or just before the breakfast and before dinner, obviously post-parental after 1.5 to 2 hours of dinner will be normal because you've taken metformin, you've taken your insulin. What is happening before your dinner? So that's very
So that was the lowest that used to come. Out of the 3 figures, that used to be the lowest that I used to get.
Even going higher than that is now we have monitors which will monitor your sugar every 15 minutes.
Okay.
You just put a sensor on the skin.
Okay.
It has a chip. It has a filament which goes into the interstitial tissues of the skin and which monitors the sugar every 15 minutes.
Okay. And then what you plot it
And
against
for
a
14
graph
days,
or something?
Then it plots into different graphs.
Okay.
Day wise, time wise, fluctuation wise, dots on graph.
What you connect it to a
Connected
PC
to
or
laptop.
a...
We have a reader, we read it and
Okay.
it comes on
Okay.
about 6 graphs which it gets. So that's the most useful when you're suspecting the patient is likely to have large variation. You said your fasting is always high.
Yeah.
So that helps a treating doctor to decide the doses and the timing of the medication.
Okay.
Timing is very important in our country because people take food at different times. People's physical activity at different times. All through the day they're not moving at all, but early morning they go for 40 minutes brisk walk in the park. So that makes it decide, because again I said, if you have good control but spikes in between, that person is equally bad with having high range sugar all through the day.
Correct.
23 hours good, but 1 hour it shoots up. He's also likely to develop complications as much as a person who has high sugar also. So if you're addressing the spikes and the lows, continuous monitoring, ambulatory, we call it 24-hour ambulatory glucose monitoring. That's very important. HbA1c definitely has its own limitation. Standardization of HbA1c is very poor, so you do not know how reliable this test is. But estimating sugar is any lab is more or less.
So just on HbA1c, I would like to ask you one thing. When I used to get the test done, and the test report used to come, so he would mention in the test report that this is the thing I have used, probably the drug or the kit. So my variations are from this one to this one. And on another day, he would give me a different number if he was using some other testing. So how do you correlate those things? It becomes a huge problem.
You have to go by that which has been given in that report. Because
So then you have to correlate with the previous report that you have?
There will be marginal difference.
Okay.
There will be marginal difference. That's why we say standardized, probably an authority which declares it to be the standard one, which is constant. 7 is the 6.5 for diagnosis and 7.
उसमें 11-12 पे भी जाता था. One particular test he used to give me, which was, I think I remember that number used to go to 11 also.
Approved kits will have the more or less same
Okay.
variation. So as far as variability is concerned, it's very important to monitor the timing and the doses of the medication and insulin. Second was that earlier part of your life, we've already addressed that. And
no, I think one of the things what Shashi said is important. I think the young are not aware of how much damage they're doing to themselves if they delay the
Correct.
issue of that.
Education, what you talked about in education.
See, even I, with all this, I was only looking at the terminal side.
Okay.
इनसे कहता था भाई ऐसा कर दीजिए कि हार्ट अटैक होए किडनी ना फेल होए, बट कभी ये नहीं सोचा कि डायबिटीज मेरे को रोज लो प्रोडक्टिविटी. If I am a creative person and my creativity is dropping by 20%, that's a huge loss for 20 years of my career.
Absolutely.
I think that to me is the most important one.
Yeah,
See,
most
at one
critical.
level you rationalize everybody will die someday. इससे नहीं मरोगे, उससे मरोगे. But अगर मैं काम कर रहा हूँ और क्रिएटिव कॉग्निटिव काम कर रहा हूँ और सब लोग आजकल नॉलेज वर्क कर रहे हैं और वो मेरी एफिशिएंसी गिर रही है, तो मैं तो वो घटिया आदमी के बराबर हो गया.
बिल्कुल.
you know what you're saying is absolutely correct, but then a young man would ask me, he's got no family history, he's fit and fine, he's into a standard life, a little bit of exercise and average diet. Do I need to get my test done?
No,
you also are going to bother, or
yeah, sure.
the person who is at high risk will bother?
नहीं, वो तो
There
है ही
comes
है.
the role of the education.
See, जैसे बताया हम लोग ना, different stages of life, different issues. आज का जनरेशन फिटबिट पहनता है, एप्पल वॉच पहनता है, और उसी से हम निकाल देंगे डेटा जो अब कर. To me the issue is whether I push in a 70-year lifespan to a 75 or 80-year, or I make you more productive at 40.
Right?
And I'm saying from the and we don't understand that.
And keep his productivity level high till about 80 or something.
See, even I, very honestly, got this appreciation only during this thing. That
Interaction with Dr.
120 is your normal range, 101 क्या unit क्या milligram per deciliter. कितना खून होता है 5 लीटर. That means 5,000 milligram is all the sugar you should have in your blood, which is 5 grams, which is 1 teaspoon. हम तो ऐसे रसगुल्ला खा लेते हैं, ये खा लेते हैं. So the pressure on the body to process that is very high. So ये जो बात है, practice denial. You just say कि हम नहीं लेंगे, and it is not difficult. I mean, I've gone through the process. See, just like when you are a vegetarian, you say नहीं लेंगे चाहे जितना अच्छा हो. So you decide I am a non-sucarian or some such thing, and I will not take sugar, right? So the issue is if you get aware of this, जैसे वो बात कर रहे थे ना, प्रोटीन लेना चाहिए नहीं लेना चाहिए ये वो. So I think that is a very important aspect.
Yeah,
But craving, sir, craving होती है.
Hey, but this is all
Whatever you may avoid something, that craving becomes so dominant at times, it becomes very difficult to avoid.
So ultimately it boils down to that education plays a pivotal
Exactly.
education.
Right.
In
And the
education
emphasis I
also-
want to say, the earlier you become aware of it,
Correct.
That's
the
exactly
better
what
it is.
it is.
It
That's
is not
exactly
that
what it is,
you
because
see
it is
अभी क्या
considered
होगा
a
कि
disease which affects you in a later part of your life.
No.
It is absolutely wrong.
see my
And talking of the same legacy effect, even if it is you're going to become diabetic, it is a treatment in the earlier part.
Okay.
Catching it early, treating it early.
Okay.
Catching it is also very important. Who should catch it? Then education again plays a role. That what are the risk factors? do I fall in a normal category? Do I fall in a high risk category? High risk category definitely should screen himself and start lifestyle modification. We call it therapeutic lifestyle modification. Right from beginning. A normal person who does not fall in high risk category should also follow lifestyle modification, but not at therapeutic level. So education ultimately is the most key area, I think, and everyone should know what are the risk criteria.
One personal question.
Your own risk factors. We have Indian diabetic risk score. Very simple. Everyone can do it yourself. Know your weight, know your waist, know your whether you are which age, and whether you have a family history of one parent.
And sedentary lifestyle.
Sedentary, whether you do physical exercise, you are sedentary lifestyle, medium or very severe moderate exercise. But taking four things in consideration, everybody can calculate his diabetic risk score. You don't need to go to a doctor.
So one personal question that I wanted to ask you at this stage. I have found when the stress is not there, if I indulge myself in sugar also, my monitoring figure remains the same. It doesn't change. And when the stress is there, even though I have a very strong control on my diet, I have that predisposition. I know कि कब कितना resist करना है. तब भी वो sugar level उतनी रहती है. या बढ़ जाती है तो फिर नीचे नहीं आती. इसका कोई है monitor? Is there a correlation between this that is there?
Stress is a thing which is very difficult to define as well as very difficult to quantify.
Businessman से जैसे risk हो गया. I lost huge amount of money in crores in my milk plant.
That's a detectable stress.
Yeah.
But what about?
नहीं ये तो कैसे notice आ गया सर?
When going to
it's a
the
huge
market,
issue.
there's a stress on me whether I'll get a parking or not.
हाँ. नहीं वो तो फिर वो इसका absolute इसका का issue हो गया ना वो तो.
Stress तो हमारा subconscious level पे stress होता है.
But as a businessman you come through huge amount of stress which is created by external factors.
High quantity or quantum of sudden stress triggers many of these things.
Definitely.
And there is this whole psychosomatic issue.
Yeah.
That if you feel good, many of the things, वो आपको पता है सारे जो endocrine system है, वो चलने लगता है, आप खुशी होता है.
Free radicals in the body, which is now been scientifically proven that you have a lot of free radicals when you are under stress. So which harm your body, which eats your tissue. It's just like a poison which is affecting all your tissues, whether it is diabetes, hypertension, heart disease, and your intellectual property. सारा कुछ खराब करता है. So coming to people living for long ages, the third issue was like
So now that you have to solve your diabetes, you have a long life.
This is a paradox. When you treat diabetes well, people are going to live. See, ultimately, whether you treat diabetes, one is that by having a tighter control, his efficiency, his productivity is good. But that's in a unquantifiable manner. But what can be measured is likely to get retinopathy, nephropathy, neuropathy, and heart problems.
फिर हाँ एक टच और करना था पेरिफेरल न्यूरोपैथी पे थोड़ा सा बिकॉज़ वो उतना कोर्स में कवर नहीं हुआ है.
So people living with long age because of n number of reasons, expectancy is going up because of good quality of medical care, good food and good environment and good social run. Diabetics, the incidence, the chances of a diabetic patient getting into these complications is definitely much higher now. But fortunately or unfortunately, we Indians are more prone to develop cardiovascular complication than retinopathy and nephropathy in comparison to the Western world. So, and cardiovascular complications are what will kill the patient. About 50% of diabetes ultimately die of the cardiovascular complications. While the nephropathy and retinopathy are nagging problems, they put you in a bad health, while cardiovascular has a high mortality.
So on this, I'd like to just ask you one question. Like my father, he never had a heart attack all his life. He was hypertensive, he was diabetic, and all of the complications. He was on beta blockers, everything. But this is one warning that most doctors say. It is talked about in terminology, also medical terminology, of a silent heart attack the diabetics suffer. So later when we diagnosed, when we were looking at symptoms, so my mother said कि भी ऐसे तो हुआ था, इनको silent heart attack हुआ था, he pulled out of it. So what is this correlation of silent heart attack, and can it be detected, can it not be detected, or is there any prevention that we can do for that, or as a diabetic?
Yeah, there are two things. One is detection, one is prevention. Detection, whether it is silent or painful, typical heart attack, prevention strategies remain the same.
Okay.
You have to do your blood pressure control, you have to do your cholesterol control, you have to do, see, the triad of the three major risk factors which are controllable for a cardiovascular risk are hypertension, cholesterol, and sugar.
Sugar.
Of course, genetic and stress and those things are there. But if you're talking medical conditions, the three triad of the three highest risk provider are that. And among these three, the priority should be vis-a-vis the cardiovascular risk. Is cholesterol first? Address that first, most important. Blood pressure second. Third, glycemic, sugar control. Sugar control may be little here and there, but always cholesterol control, because they are the one which makes plaques and atherosclerosis. Second is hypertension control. Third priority, of course, need to be done. All three need to be done. So preventive strategies, whether he is going to get a silent heart attack or a frank heart attack, remains the same. Ensure good blood pressure control, keep his cholesterol down, keep his sugar control. Why do diabetics get a silent control? Is because they have certain neuropathic issues. So they can get silent heart attacks. That's the only thing. Preventive strategies is this. Treatment strategies are again, and how to detect it. You said detection. Detection will also be the same vis-a-vis a non-diabetic patient or diabetic patient. We classify a patient to be in a high cardiovascular risk according to certain parameters. Flemington scores and all those scores, we can say that he is in a high risk category to develop cardiovascular complications. If he is into that, then of course investigation should be done. Commonly I would say, if the resting ECG is normal, if you do a routine going to your physician and he does a routine ECG and there are certain changes, you should always go for a complete cardiac check. If he already got a diabetic nephropathy or retinopathy, if you already got other two complications of diabetes, always get a detailed cardiac checkup. If he is in high risk because of other reasons, because of his age, he is already crossed 65 years of age, he is male, he is a tobacco chewer or a smoker, if he is into high stressful life, if he's already developed a peripheral vascular disease, all these situations put him in a category that he needs to be investigated thoroughly for a cardiovascular assessment. That's the way you can pick up. If he's already getting into towards that, take a action straight away. If he's already coronary arteries are blocked to 70-80%, do a revascularization strategy. Certain parameters are there to decide whether he needs to have a complete cardiac checkup or we can just wait.
So addressing this question.
Now I think we can go on to that vaccination part, and then you can do your general presentation.
Vaccination, wherever I talk about adult vaccination, people are shocked that vaccination, we put it synonymous with children, that every child needs to be, and I'm sure every mother, whether working or a housewife, everyone knows that my child needs to be vaccination through this schedule. Every doctor gives them a pamphlet saying, birth pe ye, Amitabh Bachchan on the TV says, do this, do that. 6-7 visits to a doctor, and you can have your child will be vaccinated for 23 diseases and whatnot. But wherever there is a benefit available to prevent a disease, why shouldn't the society take the benefit out of it? If there are vaccinations which can prevent an elderly person, more so a person who's got diabetes, hypertension, coronary disease, to develop certain diseases, vaccination is available today. So we have now, there is a strategy we call it an adult vaccination program. 5-6 vaccines are being talked about. I'll just enumerate them. One is an influenza vaccine. People who are in old age, not adult, we can say old age vaccine, or who have morbid conditions, a metabolic disease, are more prone to develop influenza, all these viral illnesses. Influenza vaccine of very high quality is available these days, which needs to be given annually, every year. The immunity lasts for about a year. Second is a pneumococcal vaccine. Pneumococcal vaccine is for preventing pneumonias. That is a one-time vaccine which can give you immunity. There are different varieties which doctor will decide which monosaccharide or multivac. Third is hepatitis B vaccine. We were just
This is the one time, sir?
Yeah, pneumococcal. We were talking about that most of the diabetics, one time or the other, they will need insulin. Insulin is injectable. So, hepatitis B vaccine, very important. Hepatitis B vaccine, if the person has been vaccinated already, no need. Last few years back, there was a lot of campaign to immunize the whole society with hepatitis B. So, if you already had it, fine enough. Otherwise, 3 doses, 016. That means you take one dose, 1 month later, second dose, third dose after 6 months. Hepatitis B vaccine, which prevents you from hepatitis B, which again affects
3 months and 6 months.
016.
016.
016.
And but this is monthly intervals.
0 means the day you take it, 1
1
month later,
and
6
6 months.
later. And then chickenpox vaccine. The only caveat is that chickenpox, if the person has already had chickenpox, frank chickenpox, it provides you immunity for your life, so they need not take it. Or if you have vaccine, then they need not take it. Otherwise, if you have not had vaccine, if you have not had chickenpox, it should be taken, because chickenpox in old age is very fulminant, very severe. You get it very badly. Plus, it also the same virus causes herpes zoster. Quite a lot of you must have heard of herpes zoster getting vesicles on one side of the body in nerve area. So this vaccine protects you against that also. Then certain optional vaccines, hepatitis A vaccine, which can provide protection against hepatitis A. Hepatitis A is the one which you get through food and waterborne disease, eating a bad food. So zoster vaccine is also available these days, herpes zoster vaccine separately. But 3-4 which I have said, influenza vaccine, pneumococcal vaccine, chickenpox vaccine, hepatitis B vaccine are very significant.
So in your practice and experience, have people started adopting
Oh, yes.
this? They've started it.
Quite a lot, quite a lot. People who are in geriatric practice or are advocating, people in the hospitals who are treating elderly diabetics and heart patients or any other major disease patient who are on dialysis, all should be vaccinated.
And
So
if
then
they-
you go to a doctor, and is this care available in a hospital, or you will prescribe and then only? Because I have not heard of this, so there is no awareness.
The vaccines are not available on the counter, chemist counter. There
Okay.
are different vaccine distributors, because the vaccine has to be kept in a cold chain.
Okay.
The temperature has to be maintained. Some vaccines 2 to 8 degrees, some 0 to 2 degrees. So there are licensed vaccine distributors. So most doctors have an access to them. If you go to a family doctor or a specialist doctor and say that what about pneumococcal vaccine, he will procure it for you. He will order from a vaccine distributor who will bring it in a
So you will take an
dry ice.
appointment to get that vaccination done
Mostly
at a
people
future
don't
date.
keep it in their clinic.
And the injection is a normal injection?
It's normal injection, normal injection.
It
They're
is
all
nothing
normal
special or
normal shots. All are normal shots.
all normal shots.
Either subcutaneous or intramuscular. They're normal shots.
Okay.
Thank you very much. Is there anything else you feel that you want to say, or otherwise you can make a
Just
general?
rush
Yeah,
it,
so let's have a
if that
general-
interests anybody, we can